Welcome to Nursing P.A.L.S, where we learn together, share stories from the heart, and work as one towards better healthcare. Haven't hit subscribe yet? Please do. It helps us grow and keep making awesome videos for you. Thanks for being with us.
Hello and welcome to our channel where we make hard-to-understand medical topics easy for you. But remember, this is not a replacement for a doctor's advice. Always check with a real healthcare expert. Today we're going to talk about seizures, which are really interesting things that happen in our brains. We're going to explain what kinds they are, why they happen, and how they can be treated. We'll cover everything from how our brains work to how to handle having seizures. So let's jump in and learn about seizures in a fun and easy way. Seizures are a manifestation of abnormal brain activity. But what exactly happens during a seizure? At the heart of this phenomenon lies our brain's basic units, neurons. Neurons are constantly sending and receiving signals, maintaining a delicate balance between excitatory and inhibitory activity. In a typical scenario, excitatory signals prompt neurons to fire, while inhibitory signals keep this firing in check. However, during a seizure, this balance is disrupted, leading to a surge of excitatory activity. This can cause neurons to fire up to 4 times their normal rate. The result? A sudden, uncontrolled electrical discharge that sweeps across the brain, causing a seizure. This abnormal electrical activity can lead to a range of symptoms, from changes in behavior and sensation to convulsions and loss of consciousness. Understanding these foundations sets us up to explore the various types of seizures. Seizures come in different types, each with their unique characteristics. Let's start with the 2 main categories of seizures, generalized and focal. Generalized seizures involve both sides of the brain simultaneously. These are further divided into 6 subtypes. The first is the generalized tonic-clonic seizure, commonly known as a grand mal seizure. It's characterized by a sudden loss of consciousness, body stiffening, and shaking. The second subtype is the absent seizure or petit mal seizure. This type is often unnoticed as it causes brief lapses in awareness, usually lasting less than 20 seconds. Next, we have the myoclonic seizure, which causes quick jerk-like movements of the arms and legs. The fourth subtype is the clonic seizure, which involves repeated jerking movements of the body. Next on the list is the tonic seizure, causing stiffening of the muscles. And lastly, the atonic seizure, also known as the drop seizure, causes a sudden loss of muscle tone and control, leading to a sudden fall or slump. On the other side of the spectrum, we have focal seizures, which start in one specific area of the brain. These are also divided into 2 subtypes, focal aware and focal impaired awareness seizures. In focal aware seizures, previously known as simple partial seizures, the person remains conscious and aware throughout. Symptoms depend on the part of the brain where the seizure starts and can include sudden and unexplained feelings of joy, anger, sadness, or nausea. Focal impaired awareness seizures, previously known as complex partial seizures, are characterized by a loss or change in consciousness. The person may appear dazed, confused, or even perform repetitive movements, such as hand rubbing or chewing. These classifications help healthcare professionals identify the type of seizure a person is experiencing, which is crucial for determining the most effective treatment approach. Each type of seizure presents differently, leading to a variety of symptoms. This diversity in presentation is why understanding the different types of seizures is key in the journey towards managing and treating this condition. The symptoms of a seizure can be as mild as a momentary lapse in attention or as dramatic as a full-body convulsion. Seizures are a bit of a chameleon in the medical world. Their symptoms can vary widely depending on the type of seizure and the individual's brain activity. For some, a seizure may present as a brief disconnect from the world, a bit like daydreaming. These are often termed as absent seizures. Others may experience unusual sensations, emotions, or behaviors before the onset of a seizure, known as an aura. This can serve as a warning sign of an impending seizure. The more well-known type of seizure, the generalized tonic-clonic seizure, can be quite dramatic. It may start with a sudden cry, followed by the person falling to the ground, stiffening of the body, and then jerking movements. As you can imagine, this can be quite distressing to witness. Let's not forget the postictal phase, a period of recovery after the seizure, where the person may feel tired, confused, or even have difficulty speaking. This phase can last from a few minutes to several hours. Now let's switch gears and talk about risk factors. Seizures can affect anyone at any age. However, certain factors can increase the risk. These include a family history of seizures or epilepsy, a history of febrile seizures as a child, or having had a stroke or brain injury. Certain medical conditions, such as Alzheimer's disease, can also increase the risk of seizures. And of course, we can't ignore the role of lifestyle factors. Excessive alcohol consumption, recreational drug use, and lack of sleep can all trigger seizures in susceptible individuals. It's important to remember that while these risk factors can increase the likelihood of experiencing a seizure, they do not guarantee it. Many people with these risk factors will never have a seizure, while others with no apparent risk factors will. Early recognition of these symptoms and risk factors can lead to timely diagnosis and management. After all, understanding the enemy is the first step in mounting a successful counterattack. Diagnosing seizures involves various tests, while management focuses on reducing seizure frequency and improving quality of life. Diagnosing seizures is a multi-step process. It starts with a comprehensive clinical evaluation, where the healthcare provider will ask about the patient's medical history and the details of their seizures, such as their frequency and duration. They will also want to know about any triggers that might set off a seizure. Following this, a neurological examination is often carried out. This examination assesses the patient's motor abilities, mental function, and other areas to determine the impact of seizures on the patient's life. One of the most common diagnostic tools for seizures is an electroencephalogram, or EEG. This test measures electrical activity in the brain. During an EEG, electrodes affix to the patient's scalp record brain wave patterns. These patterns can help identify abnormalities that might indicate a seizure disorder. Now let's shift our focus to the management of seizures. The primary goal here is to reduce the frequency of seizures and improve the patient's quality of life. This often involves medication, specifically anti-epileptic drugs or AEDs. These medications work by altering the electrical signals in the brain to prevent seizures. The choice of medication depends on several factors, including the type of seizures, the patient's age and overall health, and the medication's side effects. It's important to note that while these medications can control seizures in a majority of patients, they do not cure epilepsy. Apart from medication, lifestyle modifications are also crucial in managing seizures. This can include regular exercise, adequate sleep, and a balanced diet. For some patients, surgery may be an option if medications are not effective. The aim of surgery is to remove the area of the brain where the seizures originate. It's also essential to remember that managing seizures often requires a multidisciplinary approach. This means the involvement of a team of healthcare professionals, including neurologists, nurses, and pharmacists, along with the patient and their family. In conclusion, managing seizures often requires a multidisciplinary approach. The journey may be challenging, but with the right diagnosis and management, people with seizures can lead fulfilling lives. While medications play a crucial role, lifestyle modifications and preventive measures are equally important in managing seizures. Let's delve into the significance of a healthy lifestyle. Eating a balanced diet, getting regular exercise, and ensuring a good night's sleep can go a long way in managing seizures. The correlation between a healthy body and a healthy mind is undeniable. Now, let's talk about avoiding triggers. Triggers are specific factors that make seizures more likely. They vary from person to person, but common ones include stress, lack of sleep, and certain foods or drinks. Identifying and avoiding these triggers can be a vital part of seizure management. Moving on to the regular intake of medication. It's essential to take prescribed medications consistently and at the correct times. Altering the dosage or skipping a dose can increase the likelihood of seizures. If side effects become bothersome, don't stop the medication abruptly. Instead, consult with a healthcare professional who can adjust the dosage or switch to a different medication. Safety considerations are also a crucial part of seizure management. For individuals prone to seizures, it's important to take steps to prevent injury during a seizure. For instance, taking showers instead of baths, avoiding swimming alone, and using protective headgear can mitigate the risk of injury during a seizure. Stress management techniques such as yoga, meditation, or other relaxation techniques can also be beneficial. High stress levels can trigger seizures, so it's important to find effective ways to manage stress. Additionally, regular checkups and open communication with healthcare professionals are key. They can monitor progress, adjust treatments as needed, and provide advice on managing seizures. Lastly, it's important not to isolate oneself. Reach out to support groups or communities, as they can provide practical advice, emotional support, and a sense of belonging. Remember, a comprehensive approach to managing seizures can lead to a better quality of life. Let's recap the key points we've discussed about seizures. Seizures are essentially a form of electrical activity in the brain that can manifest in a multitude of ways. They are not a disease in themselves, but rather a symptom of many different disorders that can affect the brain. Some seizures can hardly be noticed, while others are totally disabling. There are several types of seizures, each with its own set of characteristics. The two main categories are focal seizures, which occur in just one part of the brain, and generalized seizures, which involve all areas of the brain. Focal seizures can sometimes turn into generalized seizures, known as tonic-clonic or grand mal seizures. The symptoms and risk factors of seizures can vary widely. Common symptoms can include temporary confusion, staring spells, uncontrollable jerking movements, and loss of consciousness or awareness. Risk factors can range from age and family history to head injuries and stroke. Diagnosing seizures typically involves a detailed medical history and a neurological exam. Tests such as electroencephalogram (EEG) and magnetic resonance imaging (MRI) may also be used. The management of seizures is primarily through medication, specifically anti-epileptic drugs. The choice of medication is determined by the type of seizure, the patient's age, possible side effects, and cost. Preventive measures and lifestyle modifications can significantly reduce the risk and impact of seizures. These may include getting enough sleep, eating a healthy diet, regular exercise, and avoiding triggers such as stress and alcohol. It's important to remember that while this information provides a good overview, it does not replace the advice and guidance of a healthcare provider. Every individual is unique, and what works for one person may not work for another. If you or someone you know is experiencing symptoms that may indicate a seizure, it's crucial to seek medical attention promptly. And finally, the interprofessional care for seizures involves a team approach. This can include neurologists, nurses, pharmacists, and therapists, all working together to provide the best possible care for the patient. We've covered a lot of ground today, but remember, this is just the beginning. There's a wealth of knowledge out there about seizures, and it's up to each of us to continue learning, asking questions, and seeking out reliable sources of information. Remember, knowledge is power. Stay informed, stay healthy, and don't forget to consult your healthcare provider for any health concerns.
Thanks for watching. Love what you see on our channel? Consider buying us a coffee. Click on the link below for more. Your support goes beyond just the caffeine boost. It's a vote of confidence that fuels our passion and dedication to delivering the best content possible. Together, we can make each video even better and continue to grow and improve. Much love and gratitude from all of us at Nursing P.A.L.S. Don't forget to like, comment if this was helpful, and subscribe.